Means it's time for Medical Minutes presented by Lake Cumberland Regional Hospital, and it's so good to have on the phone with us this morning calling in Dr. Sandy Schuldheisz, a pulmonologist here in Somerset, known by so many as Dr. Sandy. So good morning, Dr. Sandy.
Good morning. How are you doing?
I'm good. It's good to talk to you, and thank you for taking the time to call in and talk a little bit, Dr. Sandy, first of all, about your office. And you help people with some respiratory issues that they have. So what exactly do you do in your office to help people stay safe and healthy and well?
Well, I've been here in Somerset since 2005. I've been blessed to be in such a great location, and we see all kinds of lung problems here, from asthma to COPD, and of course, lung cancer and everything in between.
Dr. Sandy, do patients have to be referred from their primary care physician to come to you, or if they have problems with asthma or any kind of respiratory issues, can they just make appointments with you directly?
Well, it would be fine if they just made an appointment with me, but unfortunately most insurances require a referral. So in general, we usually ask for them to talk to their primary provider to get that referral, but we will work with anybody that calls us.
And Dr. Sandy, you are doing what I believe is a relatively new procedure, and I hope I'm pronouncing this correctly, but it's a procedure called navigational bronchoscopy. Can you talk about that?
Sure. So it is super exciting for our region to have the availability of navigational bronchoscopy. So bronchoscopy is basically taking a camera down into the lungs to identify abnormalities, specifically nodules that are found. And it's been around for a very long time, since the 1960s, but it's had a lot of limitations because of its size and lack of flexibility.
Yes.
So in 2018, they came out with something called robotic bronchoscopy or navigational bronchoscopy. And it's a very high-tech system where you basically load the patient's CAT scan disc into the robot. And just like your GPS on your car or on your phone, you identify the spot that you want to go to, and the pathway is identified, and I basically take a very flexible fiber down into the airway, and I follow the path that's outlined for me, just like on your GPS on your car. And when I arrive at my destination, so to speak, the screen changes color, that the nodule is sitting right in front of me. And so I'm able to directly go into these lesions now robotically, and in the past, it just wouldn't have been possible because they were so far out in the lung, in the periphery, that we couldn't reach it, and the scopes just were not flexible enough to do that.
And the nodules that you mentioned, Dr. Sandy, are these similar maybe to like polyps in a colon? What exactly are the nodules, and how important are they to be removed?
So nodules are extremely common. This is basically your body that is either creating a reaction that we can see on the CAT scan, the famous spot in the lung, and fortunately most of those are going to be benign, meaning not cancerous.
Yes.
But it turns out when they're very small, we just can't really say for sure. So the patients in the past have had really only two options. One was just to follow these with a series of CAT scans over a couple of years to make sure that they didn't grow, or they faced an invasive procedure, a chest surgery, to go in and remove that. And so you can see both of those options were not very satisfying to me as a pulmonologist or to the patient. So now, with this technology, we're able to find these nodules early, and we are hoping to change the trajectory of lung cancer here in Kentucky. We now screen all smokers from the age of 50 to 80 with a yearly low-dose CT scan. So I would tell the listeners, please talk to your provider. If you're not having that done, you need to. It's paid for by insurance. And so we are now finding lung cancer at stage 1 instead of stage 3 and 4. And in my practice, just in the last year, we have found 13 stage 1 lung cancers by early detection and taken them out, and the patients are a cure. That's what we're looking for.
That's what you want. Dr. Sandy, we hear a lot of times of people having lung cancer who weren't smokers or who didn't grow up or be around a lot of secondhand smoke. So who needs to consider this procedure, and who needs to consider getting their lungs checked for these nodules and potential lung cancer?
So as of right now, the only protocol for the low-dose CT scan is if you have accrued a 20-pack-year history of smoking and you're between the age of 50 and 80. What we know, unfortunately, is that secondhand smoke is huge. So people that have never smoked but lived with a smoker, are developing lung cancer. I think an interesting take-home from today for our listeners should be that in our region, we have a fairly high incidence of radon in our ground. Our local library has the detection system that you can check out, and then proceed with having that removed, that removal system placed in your home. In addition, there's other occupational exposures, specifically asbestos, that is a risk factor for cancer. And then who knows, there's probably lots of things out there that we just haven't identified yet. But as of right now, we don't have any screening other than in smokers, unless you have some kind of concerning symptom. And
Dr. Sandy, what would you say to listeners to help prevent lung cancer? Obviously, stop smoking would be one, but what else can people do to keep their lungs healthy and potentially prevent lung cancer from an early age?
I think as far as we know right now, avoiding inhaled carcinogens, specifically, tobacco is the biggest one. Again, asbestos, other work environment. We take for granted our lungs because we have a lot of reserve, and we're sort of young and reckless early on and destroying the lungs. So just keeping in mind air quality, wearing a mask if you think the air quality is bad, and avoiding known carcinogens.
And what about, Dr. Sandy, vaping as opposed to smoking? A lot of people are vaping because they think it might be a bit safer than smoking cigarettes. What's your thoughts on that?
So in general, as a pulmonologist, I have to tell you that vaping is not good for you. You're still inhaling something into your lungs that shouldn't be there. I will tell you, however, that I have worked with many patients in my practice using vaping as a bridge to becoming a non-smoker. So they want to quit smoking, and they're wondering about using vape as a bridge to come off of that. I have to tell you, I've been supportive of that because at least they're coming off the cigs, and then we come up with a plan to come off the vaping. Unfortunately, our population that I'm really worried about is our high schoolers and our college kids. And I've had several on life support in the intensive care unit, college kids that have vaped things that have been laced with other substances.
Oh, wow.
So sometimes you just don't know what you're getting when you're vaping. So I would just tell the audience to be careful, and it would be better if you didn't.
And you mentioned, Dr. Sandy, about wearing masks sometimes when the air quality is not good. A lot of air quality, and sometimes here, but in other cities because of the wildfires in Canada, the smoke coming down. How much does that affect, and what's the residuals of even short-term breathing in air quality, air that's not of good quality?
I think our population of asthmatics are the ones that suffer the most. We don't have long-term studies right now of just, the Canadian fires and things like that, but we know when I lived in Michigan, for example, we had regular air quality monitoring that was dispersed out to the public, warning to patients that had COPD, or asthma to get a mask on or stay in a controlled environment. So it's an irritant, and if you have enough long-standing irritation of the lungs, you start to change the lungs and potentially start to get asthma physiology that could be irreversible.
And Dr. Sandy, I always like to ask all of the doctors that call in from the hospital, coming from your perspective as a doctor, how important is it for people to have a primary care physician who can recommend you if necessary, and for people to be proactive about their health beginning early?
It's just of pivotal importance, and a lot of us are just really bad at that. But, having a good primary care provider is a safety net for you, keeping you going in good times and in bad, and watching for things that you might not be aware of. So it is much better to have somebody with an established relationship monitoring your care, continually going into urgent care or prompt care, different providers. They serve a great purpose, don't get me wrong, but it is good to have somebody that's really anchoring you and navigating through life. Because as things change, you need various workups, you need various screenings, and your primary care is the best to keep you on track with that.
And they know your history, right? They know you.
Exactly.
So, Dr. Sandy, you did say that you do, for the most part, have to be referred, patients have to be referred to you from another physician. But where is your office located? And if people want to contact your office, have questions, can they do that? What is the best way to know more about you and your office and what you do?
Sure. So I'm located off of Hale Knob Road at 46 Turpin Court, Suite B, and my number is 606-679-0179. And anybody can call, and we can work with your primary care. We call them many times and say, hey, you've got this sweet lady that wants to come and see us. Can you help us out? So don't hesitate to call, and my practice manager, Regina, will be happy to tell you any other ins and outs of the practice. And we're very user-friendly, and I will tell you, practicing very state-of-the-art medicine here in Somerset, Kentucky.
Dr. Sandy, always good to talk to you. Thank you so much for calling in this morning, and we hope to talk to you soon, and have a great rest of your day.
All right, have a blessed day. Thanks so much.
Thank you. That was Dr. Sandy Schuldheisz, a pulmonologist here in Somerset. It's been Medical Minutes presented by Lake Cumberland Regional Hospital. It is 8:42 on